All right, welcome to The Explainer. Today, we are doing a deep dive on a drug that's in probably every medicine cabinet out there, diphenhydramine. You almost certainly know it as Benadryl. And yeah, it's super common, but its effects are anything but simple. We're going to break down exactly how it works and why it's used for so many different things.
So you've seen it, right? You walk through the pharmacy and you see it in the allergy aisle. Then a few feet away, you see it again, but this time it's being sold as a sleep aid. So what's the deal? How can one single drug tackle such different problems? Well, let's get into it.
First things first, let's clear up the names. The official generic name, the one you'll see in textbooks, is diphenhydramine. But in the real world, you know it by its trade names, right? Benadryl for allergies, Nidal or Somanex for sleep. The key thing to remember is that it's the exact same active ingredient, just wearing a different hat.
And that brings us perfectly to our first section. We need to figure out what this drug is and what we actually use it for. This is where you really start to see why it's such a jack of all trades in the medical world.
Okay, this table really tells the whole story. Its pharmacologic class, that's what it is on a chemical level, is a first-generation H1 receptor antagonist. But look at its therapeutic class. That's what we use it for. It's an antihistamine, sure, but it's also an antitussive for coughs, an antiemetic for nausea, and a sedative hypnotic for sleep. It's got a pretty impressive resume.
So all those classifications mean we use it in a whole bunch of ways. Its main gig, its primary use, is fighting allergies, everything from a running nose to a serious allergic reaction that needs an IV. But its secondary or off-label uses are just as famous. We literally use its side effect of drowsiness to treat insomnia, and its other properties to help with motion sickness and even some pretty specific movement disorders.
So, you've got to be asking, how does one little molecule do all of that? Well, it all comes down to what it does at the molecular level, and it's all about blocking one of your body's most important chemical signals.
Before we can get diphenhydramine, we have to talk about histamine. Think of histamine as the body's alarm system. When you're exposed to an allergen like pollen, your mast cells freak out and release a flood of histamine. That histamine then docks onto these things called H1 receptors, and bam, that's what causes all the misery, the itching, the sneezing, the swelling.
And this is where diphenhydramine comes in to save the day. It's what we call a competitive antagonist. It's pretty clever, actually. It doesn't stop your body from releasing histamine. Instead, it races the histamine to the H1 receptors and gets there first, blocking the docking site. It's kind of like a security guard standing in front of a door. The histamine can't get in, so it can't trigger the allergy symptoms. No binding, no problem.
Okay, so we know how it works, but now let's track its journey through the body. This is called pharmacokinetics, and a really easy way to remember the steps is with the acronym ADME.
So ADME stands for absorption, distribution, metabolism, and excretion. It gets absorbed easily, your liver breaks it down, and you get rid of it in your urine. But the most important part of this whole story, the real key, is distribution. Look at that. It crosses the blood-brain barrier. That's huge. That's the reason it makes you sleepy, and it's the single biggest difference between an older first-generation antihistamine like this one and the newer ones that don't cause drowsiness.
And it gets to work fast. After you take it orally, it hits its peak level in your bloodstream in just 1 to 2 hours. That quick onset is exactly why it's so good for dealing with an acute allergic reaction that's happening right now.
But now, look at this. Its half-life is up to 32 hours. That means it can take a day and a half for your body to get rid of just half the dose you took. This is precisely why you can feel that groggy Benadryl hangover effect the next morning. The drug is still hanging around in your system doing its thing.
So because this drug is so powerful and sticks around for so long, we absolutely have to talk about the red flags. It's crucial to know who needs to be extra careful with this drug and who should probably just avoid it altogether.
Here's the most important lesson. Just because it's over-the-counter does not mean it's risk-free. Not at all. Diphenhydramine has what we call anticholinergic effects. Basically, it has a drying effect on the body. That can be really dangerous for people with asthma, glaucoma, or urinary problems. And this is critical. Never, ever mix it with other things that slow down your brain, like alcohol. That combination can seriously amplify the sedative effects and become dangerous.
And if someone takes way too much, those anticholinergic effects go into toxic overdrive. This creates a really specific and dangerous set of symptoms. We're talking hallucinations, seizures, and classic physical signs like flushed skin, a super dry mouth, and pupils that are fixed and dilated. It's a true medical emergency.
All right, so beyond those huge red flags, let's break down the other adverse effects.
It's important to separate what's pretty common and expected from what's rare but life-threatening. This chart lays it out perfectly. On the left, you've got the stuff you'd pretty much expect: drowsiness, feeling a bit dizzy, and that classic dry mouth. But on the right, that's the scary stuff. These are the rare but severe toxicities you have to be able to recognize, like seizures, coma, a total collapse of the cardiovascular system, and even a dangerous condition where your white blood cell count plummets.
Okay, let's pull all this science together and bring it to the bedside. How do we take everything we've just learned and use it in a real-world clinical setting to help our patients safely? For your average adult dealing with seasonal allergies, the standard dose is going to be 25 to 50 milligrams every 6 to 8 hours. And remember, we can give it by mouth, but if things are more serious, it can also be given through an IV or as a shot into the muscle.
Now this is a really important safety point. The sources we used for this explainer did not provide specific dosing for kids, and especially not for newborns or infants. Dosing for children is incredibly specific and has to be looked up in a dedicated pediatric resource. You never, ever guess with kids.
Okay, when you're talking to a patient about this medication, these are the absolute must-knows, the teach back points. Number 1, you are probably going to get sleepy, so please, no driving. Number 2, absolutely no alcohol or other sedatives. Number 3, let us know if you have any trouble urinating. And number 4, a little pro tip, suck on hard candy or ice chips to help with that annoying dry mouth.
And finally, here is your clinical pearl. This is one of those high-yield facts you need to file away for your exams. Beyond allergies, IV diphenhydramine is the go-to treatment for something called an acute dystonic reaction. This is a scary side effect of some antipsychotic meds, where a person's muscles lock up. It's a key use you might not think of right away.
So, as we've seen, this incredibly common drug has a surprisingly complex and powerful profile. And that leaves us with a pretty big question to think about. Knowing everything we know now about its potent effects on the brain, its long half-life, its list of side effects, should a first-generation drug like this still be so easy to get right off the shelf? It's a really interesting debate about balancing convenience with safety.